Welcome back to Aesthetics Magazine. Discover more skincare resources at aestheticsmagazine.com. In this episode, we are going to offer a crash course in chemical exfoliation. Each state has different regulations on the level of professional certification required for performing different levels of chemical exfoliation treatments. Well-established aesthetics professional training programs should cover both the theoretical and practical aspects of chemical exfoliation treatments and provide students with the knowledge and confidence to perform the treatments safely and effectively. As estheticians, it is important to do a thorough client consultation before performing any chemical exfoliation treatments in order to ensure the treatment is safe and suitable for the individual clients. Also, we need to be cautious about the potential side effects and complications such as hyperpigmentation, infection, and prolonged erythema. Clients should be advised to strictly follow the pre- and post-care instructions to minimize the risks and to achieve optimal treatment results. There are different types of chemical exfoliants used in the industry, but they can all be divided into two categories based on their chemical properties: alpha hydroxy acids, BHAs, and beta hydroxy acids, BHA. BHAs are water-soluble and mainly work on the skin surface to weaken the connections between dead skin cells, leading to easier sloughing off of the damaged layers. They are generally milder and better for sun-damaged and dry skin, and work well on superficial and dry imperfections. Well-known BHAs include glycolic acid, lactic acid, and fruit acids. On the other hand, BHA, also known as salicylic acid, is oil-soluble and can penetrate through the sebum into the hair follicle. They are most suitable for acne-prone and oily skin to exfoliate inside the follicle and to prevent pore congestion. Also, BHA has anti-inflammatory and antibacterial properties and is often used for treating blemish and blackhead. Generally, chemical exfoliation can be classified as superficial, medium, or deep, depending on the strength of the exfoliating agent and how deeply it penetrates the skin layers. More aggressive exfoliation tends to produce more visible results, but it also carries higher risks and longer recovery time. Chemical exfoliation is a technique used to remove dead skin cells and promote regeneration of new skin tissues. It is a popular and effective method in the aesthetics industry to help clients achieve a smoother, more radiant, and youthful complexion. Compared to physical exfoliation, which mechanically sloughs off dead skin cells using a gritty substance or a rough surface, chemical exfoliation involves the application of various acid or enzyme-based solutions to the skin in order to peel away the damaged outer layers. The depth of the exfoliation and the specific purpose of the treatments can vary depending on the type and concentration of the exfoliating agent used and the duration of the application. A deeper penetration can be achieved with chemical peels because they utilize acidic and enzymatic ingredients. Chemical peels can exfoliate the skin at various levels and, depending on the type and strength of the peel, can be used to treat a variety of skin conditions such as hyperpigmentation, aging, and acne. There are different kinds of chemical peels, and they are categorized based on the type of acids used and the depth of exfoliation. For example, a very superficial peel can exfoliate only the top layer of the epidermis, while a medium-depth peel can reach the middle layer of the epidermis. It is important for the esthetician to provide a thorough evaluation of the client's skin and a consultation in order to determine the best peel for the client's goals and expectations. After the skin is properly cleansed and prepared, the chemical peel solution will be applied in small sections at a time. The client may feel a temporary, slight tingling or stinging sensation. Depending on the type of the peel, the length of time the solution remains on the skin will vary. For example, a light superficial peel may require the esthetician to apply and remove the substance within a matter of minutes. On the other hand, a medium-depth peel will require the peel to be left on and the skin may be periodically cooled with a fan for several minutes during the treatment. It's important for estheticians and clients alike to be aware of potential adverse reactions and understand how to properly manage them. For example, a client may experience post-inflammatory hyperpigmentation, herpes simplex, bacterial infections, or even allergic reactions. For each of these potential side effects, knowing the proper steps to minimize risk and properly manage the skin during the healing process is an important part of the chemical peel procedure. Chemical exfoliation uses specific acids to dissolve the bonds that hold skin cells together. We primarily use alpha hydroxy acids, BHAs, beta hydroxy acids, BHAs, and enzymes. BHAs are water-soluble and particularly effective for exfoliation and hydration. They're great for sun-damaged and dry, thickened skin. Common AHAs include glycolic acid, lactic acid, and mandelic acid. Glycolic acid is the smallest AHA molecule, so it penetrates the skin the easiest and is the most effective at treating fine lines, acne, blackheads, dullness, and oiliness. However, it can be harsh and has the potential to cause more irritation than other AHAs. Lactic acid is a larger AHA molecule and is typically more gentle, making it best for sensitive skin. It's effective at improving skin discoloration and the appearance of aging skin. Mandelic acid has the largest AHA molecule, so it's the gentlest and best for those with sensitive skin, rosacea, or redness. This AHA is effective at treating acne, oiliness, and wrinkles. BHAs are oil-soluble and particularly effective for exfoliation and treating acne and blackheads. This type of chemical exfoliant can penetrate oil buildup, making it effective for oily and acne-prone skin. The most common BHA is salicylic acid. It's a mild acid that's gentle enough for all skin types but has anti-inflammatory properties and is effective at treating acne, blackheads, and whiteheads. Enzymes are proteins that work to selectively break down the keratin protein on the surface of the skin, resulting in smoother and softer skin. They're best for those sensitive to acids, and they're especially great for treating redness and inflammation. Common enzymes used for chemical exfoliation include papain from papayas and bromelain from pineapples. Both are gentle and effective for most skin types. Another important responsibility of estheticians is to ensure that clients are well informed about pre- and post-treatment care. The success of a chemical peel is not only determined by the type of chemical used, peel strength, and the esthetician's expertise, but also by the patient following prescribed pre- and post-treatment care instructions. Before the treatment, many practitioners recommend that the skin be preconditioned with topical applications of tretinoin or AHA as directed. This would help to reduce surface oils, remove dead skin cells, and enhance the penetration of the chemical peel solution. Also, a broad-spectrum sunscreen with an SPF of at least 30 should be used daily. Patients should avoid prolonged exposure to the sun for 48 hours. Healing agents should be recommended to the patient to maximize the effect of the peel and reduce the chance of any known side effects. Products containing growth factors, such as regenica, and antioxidants like vitamins A, C, and E are highly recommended. To avoid infections, it is important that only freshly cleaned and dried hands touch the skin, and all makeup should be removed before bedtime during the healing period. Sun protection is also critical in the post-treatment period, and a broad-spectrum sunscreen with an SPF of at least 30 should be used daily. Patients should be sun-smart, meaning avoiding prolonged exposure to the sun, and use sun protection like wearing hats and using umbrellas. In the case of adverse side effects, patients are advised to stop using the products and consult their doctor immediately. More importantly, the esthetician should provide clear written instructions for pre- and post-treatment care and ensure that patients understand and are committed to following the instructions religiously. Discover the natural power of vitamins with this new book, Understanding Vitamins in Skincare by Greg Rishaw. Learn how vitamins can nourish, protect, and renew your skin, all while embracing a healthy, balanced approach. Get your copy today and uncover the secrets to natural ingredients. Understanding Vitamins in Skincare is available now on Amazon.com.